What if everything you assumed about controlling blood pressure was only half the story? Every single morning, tens of millions of older adults in this country swallow a pill for their blood pressure without ever being told that certain daily habits, completely free, backed by the same clinical research that approves medications, can lower blood pressure by numbers that rival or in some cases exceed what those pills actually deliver. I am not here to tell you to throw your prescription in the trash. That is not what this is. But I am here to tell you something that should have been said in your doctor's office a long time ago. Medication is one tool. It is not the only tool. And for millions of seniors, the tools nobody told them about are the ones that could change everything. Stay with me because what I am about to share is backed by published clinical research and it will cost you nothing. My name is Dr. Williams James. I have practiced cardiovascular and geriatric medicine for 25 years. I have prescribed blood pressure medication thousands of times. And I have also watched patients reduce and in some cases eliminate their need for it entirely through specific, consistent, evidence-based daily habits. Today I am sharing those habits with you directly. Here is what most people are never told at the pharmacy counter. The American Heart Association defines high blood pressure as anything consistently above 130/80. More than 70% of adults over 65 meet that definition, and the standard response in most clinical settings is a prescription, fast, measurable, and covered by insurance. But research published in major cardiology journals consistently shows that specific lifestyle interventions lower blood pressure through the same biological pathways that medications target, and in some studies, with comparable results. A landmark analysis published in the British Journal of Sports Medicine found that certain exercise interventions outperformed commonly prescribed blood pressure medications in head-to-head comparisons of their pressure-lowering effects. Most patients are never shown that research. Most patients are handed a prescription and sent home. That changes today. Think of your blood vessels like a garden hose connected to a pump. When the pump is working too hard and the hose walls are stiff and narrow, the pressure inside the system climbs dangerously high. Blood pressure medications work by either relaxing the hose walls, slowing the pump, or reducing the volume of fluid moving through the system. Every habit I am about to share works on one or more of those exact same mechanisms, not through chemistry from a pill, through your body's own biological response to specific inputs. The pathways are identical, the source is different. The first thing that lowers blood pressure better than most people realize is slow, controlled breathing practiced deliberately for just a few minutes each day. This is not meditation advice dressed up in health language. This is physiology. When you breathe slowly and deeply, specifically extending your exhale longer than your inhale, you directly activate the parasympathetic nervous system. That activation signals your blood vessels to dilate and your heart rate to slow. The result is an immediate and measurable drop in blood pressure. A device-guided breathing study published in the journal Hypertension found that practicing slow breathing for 15 minutes daily produced an average reduction of 15 millimeters of mercury in systolic blood pressure over 8 weeks. That is a number that matches what many first-line blood pressure medications deliver. 15 minutes, no prescription, no pharmacy, no cost. The technique is straightforward. Inhale gently for 4 counts. Exhale slowly for 6 to 8 counts. Repeat for 10 to 15 minutes each morning. Consistency is everything here. One session does very little. 30 days of daily practice does something genuinely significant. The second habit is one that almost every senior can begin today regardless of their fitness level. It is walking, but not walking the way most people do it casually and inconsistently. Research from the Journal of the American Heart Association found that 30 minutes of moderate intensity walking 5 days per week produced sustained blood pressure reductions comparable to low-dose antihypertensive medication in adults over 60. Walking works because it stimulates the production of nitric oxide, a compound that causes blood vessel walls to relax and widen. When your vessels widen, resistance drops. When resistance drops, pressure drops. The key word the research emphasizes is consistency. A 30-minute walk 3 times this week and nothing next week does not produce the same result as 30 minutes 5 days every week for 2 months. The body needs a sustained signal before it makes structural changes to how the vessels behave. Start where you are. If 30 minutes feels too ambitious right now, begin with 10 and add 5 minutes each week. The direction matters more than the distance on day one. If what you are hearing today is giving you a clearer picture of what your body is actually capable of without a prescription, subscribe to this channel right now. Every week, I bring you honest, research-based guidance for adults over 60 who deserve the full story about their health. Subscribe and stay with me. The third habit is dietary, and it is more specific than simply eating less salt, which is advice so broad it rarely produces real change. Clinical research consistently points to one dietary pattern as the most powerful food-based intervention for high blood pressure ever studied. It is called the DASH diet, Dietary Approaches to Stop Hypertension, and a landmark trial published in the New England Journal of Medicine found that following this pattern reduced systolic blood pressure by an average of 11 millimeters of mercury in adults with hypertension. 11 points from food choices alone. The core of the DASH approach is not about restriction. It is about addition, adding potassium-rich foods like bananas, sweet potatoes, and leafy greens, adding magnesium through nuts, seeds, and whole grains, adding calcium through low-fat dairy. These minerals work together to counterbalance the effect of sodium on blood vessel tension. Most seniors are not deficient in sodium. They are deficient in the minerals that balance it. The single most impactful swap most seniors can make immediately is replacing processed and packaged foods, which carry enormous hidden sodium loads, with whole foods that deliver the minerals the cardiovascular system needs to regulate pressure naturally. The fourth habit surprises almost every patient I discuss it with. It is strength training. Most seniors associate strength training with building muscle for appearance. The cardiovascular benefit is almost never discussed. But a meta-analysis published in the Journal of the American Heart Association examining dozens of controlled trials found that regular resistance training reduced systolic blood pressure by an average of 8 millimeters of mercury in previously sedentary adults, 8 points from lifting weights or using resistance bands 2 to 3 times per week. The mechanism is direct. Resistance training improves the elasticity of arterial walls. Stiffer arteries create higher pressure. More elastic arteries allow pressure to normalize. As we age, arterial stiffness increases naturally. Resistance training actively pushes back against that stiffening process at the cellular level. You do not need a gym. You do not need heavy weights. Bodyweight squats, wall push-ups, and resistance band exercises done consistently 2 to 3 times per week deliver the biological signal your arterial walls need to maintain their flexibility. A patient named Arthur came to see me at 71 with a blood pressure reading of 158/94 and a prescription for amlodipine he had been taking for 2 years. Arthur was not opposed to the medication, but he told me plainly that he hated the ankle swelling it caused and that he wanted to know if there was another way. We did not remove his medication immediately. Instead, we built a structured plan around all 4 of the habits I just described. Daily slow breathing each morning, a 30-minute walk 5 days per week, a gradual shift toward the DASH dietary pattern, and a simple resistance band routine twice a week. At his 3-month follow-up, Arthur's blood pressure had dropped to 134/82. His cardiologist, working with the data I had tracked, reduced his amlodipine dose by half. By month 6, Arthur's reading was consistently 128/79, and his cardiologist discontinued the medication entirely under careful monitoring. Arthur told me at that appointment something I think about often. He said, "Dr. James, nobody ever told me my body could do this on its own. I thought the pill was the only option I had." That gap in information is exactly why this conversation matters. Here's your practical starting point beginning today. Choose one of these 4 habits to begin with this week. Just one. Build it into a consistent daily routine before adding another. Consistency with one habit produces more measurable results than inconsistency with all 4 simultaneously. Track your blood pressure at home using a reliable cuff. Measure at the same time each day after 5 minutes of quiet rest. Bring that log to your doctor. Patterns measured consistently over weeks give your physician far better information than a single reading taken in a clinic. Do not stop or reduce your blood pressure medication without your doctor's direct involvement and supervision. Arthur's results happened because his cardiologist was monitoring every step of the process. And have a direct conversation with your doctor about which of these habits might be appropriate to incorporate alongside your current treatment plan. Ask specifically, if I make these changes consistently over 3 months, could we reassess my medication needs together? That question alone opens a door most patients never know to knock on. Your blood pressure does not have to be a lifelong sentence managed only by a daily pill. Your body has mechanisms built into it that respond to specific inputs with measurable, documented, clinically proven results. Slow breathing, consistent walking, strategic nutrition, resistance training. None of these cost $1. All of them have research behind them that your pharmacy bag never mentioned. Arthur is not exceptional. He is simply informed. And now so are you. I want to ask you one question in the comments right now. Which of these 4 habits are you going to start with this week? Tell me. Your answer might be exactly the push someone else watching this video needs to begin. Please share this video with someone you love who is managing high blood pressure. What they learn here could genuinely reduce what they need to take every single morning. Subscribe and stay close. Next time we are going to talk about the specific foods that silently push blood pressure higher in seniors, and several of them will genuinely surprise you. You have more power over this than anyone ever told you. Use it. Everything I have shared today is general medical information based on research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Never stop, reduce, or adjust a prescribed blood pressure medication without first speaking with your physician. Always consult your healthcare provider before making changes to your medication, diet, supplements, or exercise routine.